Hi everyone, my name is Sauman, and today I'll be discussing how to address problems with deploying machine learning for disease prevention. So I'm currently a rising senior at Thomas Jefferson High School for Science and Technology in Fairfax County, Virginia, and I'm really passionate about computer science and specifically machine learning. I'll be serving as the TJ Machine Learning Club captain during the next school year, and I hope to get more students interested in this really fascinating field. I've also written and published a few machine learning research papers, which is applied machine learning in medicine. And finally, outside of school, I like to play tennis and got the opportunity to represent my school as part of their varsity tennis team. So to start off this presentation, I would like to go back to an event that occurred in 2018. Uber was testing their new self-driving car in Arizona when suddenly a pedestrian was walking with their bike across the street. Unfortunately, the vehicle's sensors were not able to detect the pedestrian properly, and this resulted in a fatal accident. According to a report in the Wired magazine, the person crossing the road was first classified as a vehicle by the automated system. Then the classification switched to other. Without detecting the bicycle object, the trajectory of the pedestrian was not calculated in time, which caused the accident. This incident likely occurred because the system was not used to the extreme conditions and a pedestrian walking with a hand. This is an example where machine learning failed. If this scenario had been tested in simulations beforehand, a person's life could have been saved. So machine learning, which allows Uber's self-driving cars to function, is also heavily used in medicine, specifically for disease diagnosis and prevention. There's currently a large focus on research which combines machine learning for medical diagnosis. And this could potentially increase accessibility of useful and sometimes even life-saving systems. As shown in the first diagram, researchers have figured out how to diagnose coronary artery disease, provided different images of a patient's face. The machine learning model is automatically able to identify certain symptoms from patients that correlate with the disease. The next diagram outlines research that was able to identify COVID-19 along with other lung diseases directly from a CT scan using a different machine learning model. So in most research, we observe the common pipeline, which starts with an image as the input to a machine learning model, which then produces an output, which is often a disease diagnosis in the medical industry. However, we've already seen evidence that machine learning has moved past this research phase. It has made its way into the medical industry through corporate products also. In the past decade, several companies have developed products that utilize machine learning to provide patients with an accurate diagnosis in an efficient manner. For example, Retina Labs gives their patients at-home diabetic retinopathy exams. Skin Vision diagnoses melanoma and other skin diseases directly from a smartphone application. And finally, Behold.ai is able to provide instant and automatic feedback to doctors just given a chest X-ray scan. So as you can see, with the rapid growth of machine learning products, global health will not just be impacted by machine learning. Global health will potentially be dictated by machine learning. And because of this, we must be extra cautious because small errors can have severe consequences, as we saw with the Uber self-driving car accident. To get a better understanding of this technology, I'll briefly summarize the training process which allows machine learning to be so powerful. For now, let's consider the case of skin cancer or melanoma diagnosis. In order to train a model, we must start off with a large data set of training images. For each of these images, we're provided with the skin condition output. In other words, we know whether the patient has melanoma or not. And this allows us to use this to train the model and identify when it is producing an incorrect output. And based off of that, we can also improve the model. But the tricky part is testing the model. Testing the model shows how to do it in real world conditions. These images have never been shown to the model, and we don't yet know what their label is. If the model performs well on the test set, we can successfully claim that the model has generalized well. So now let's look at a more specific scenario. I've shown some sample images from a theoretical training set and a test set. And probably the first thing you notice is the obvious skin shade difference between the two sets. The training set has a much lighter skin shade. As a result, when we test it on darker images, it's unlikely that the model will perform well. Proving that this was indeed true, along with solving this bias problem, was the focus of one of my recent research papers. So in this paper, I developed an algorithm and a new model called the LatentNet, with the goal of reducing bias in melanoma diagnosis. I tested a baseline model that's represented by the blue bars against my proposed LatentNet model represented by the orange bars that you can see in the graph. I tested the images on 3 categories of images, which are created by analyzing the skin shade according to something known as the Fitzpatrick scale. The results were satisfactory because we can see a large improvement, especially in darker images, or those corresponding to types 2 and 3 of the Fitzpatrick scale. If my proposed model were to be deployed, it would be significantly more reliable on unique testing conditions. But skin color is only one factor that varies in real-world conditions. Almost every machine learning model suffers from this generalizability problem. Last year, the Radiological Society of North America hosted the Brain Tumor Segmentation Challenge. One of the tasks was to determine the MGMT promoter methylation status from MRI scans using deep learning and machine learning techniques. This surprising and also somewhat disappointing outcome revealed a large issue in machine learning that must be fixed. When the participants' models were tested on a hidden private data set, the top results went all the way down from 0.9 down to 0.62. So once the competition was over, the organizers revealed that the private data set contained images collected from varying institutions, but not a part of the training set. This perfectly simulated real-world conditions, since the models will need to work on MRI scans collected from any hospital, not just those included in the training set. And that led to the focus of my most recent research project. The quality of MRI scans across different hospitals vary drastically. For example, some scans store very detailed representations of the brain, as you can see on the right, whereas other scans store very limited amounts of detail, as you can see on the left. So my goal was to make the quality of all MRI scans equal without decreasing the quality of any scan. I did this through a generative architecture I call the ISGen, which is short for the intermediate state generator. Theoretically, it should be able to automatically increase the quality of the scan to include as much information about the brain as possible. So I tried to do research as a student that will allow machine learning to make its way into the medical industry. I really hope that more research will also take on this task. In order to deploy machine learning tools for disease prevention, models must be tested exhaustively to work in unpredictable real-world conditions. Once the models are deployed, it'll be too late to solve these problems and consequences will be apparent. If machine learning is carefully deployed, I truly believe that it can revolutionize global health. Thank you for listening, and here are some references for additional information. And I'd like to thank my family for supporting me and guiding me through my research, and also Dr. Cheng from UC Irvine for useful advice on my research. If you would like to learn a little bit more about me, my contact information is on this slide. And finally, thank you so much to the Global Health Leaders Conference team for this amazing opportunity. Thank you.